everyone, my name's Isha, if you don't know me. I'm currently a senior here, and I'm doing this presentation as part of my Honors Mentorship class, which is one of the internship programs here. And I currently intern at a clinic called Gwinnett Pulmonary Group. So a little bit about my site. Like I said, I work at Gwinnett Pulmonary Group, and my primary activity is just to shadow all the different providers there. So what's really cool about our group is that there are 3 different locations, so we have a lot of different providers. We have like 12 providers. So I get to shadow everybody from physicians to nurse practitioners to medical techs. So it's been really cool to see all the different careers in healthcare. And some of my activities, I pretty much just assist however I can. So a lot of the times that means getting sample medications for the patients or giving and helping with paperwork for the providers. So 480,000 deaths per year in the United States are caused by smoking. This is 10 times as many U.S. citizens who have died from all the wars fought in the U.S. This causes 90% of all lung cancer deaths and is responsible for 80% of all deaths from chronic obstructive pulmonary disease, or COPD, which we're going to talk about in a little bit more depth. So if you didn't guess from that, I mainly focused on smoking. So at the beginning of the year, we have to pick one essential question. So we got to decide about a month into our internship. So I realized that smoking history was one of the really big things that providers would always ask their patients about, and it was something that I wanted to look into a little bit more. So my question was, why does smoking have long-term effects on the lungs? To what extent are those effects, and how does this affect the treatment of current smokers compared to non-smokers? So this is the process essentially that I followed, what I need to know, which was looking at my essential question, what I already know, the search, and then our results. So like I said, I noticed that patient smoking history was a really important part of the diagnostic process, as well as looking at how much lung damage there is in a patient. And I've always been really interested in addiction, so it was really interesting for me to look at it from that viewpoint and seeing what the physical impact of having an addiction like smoking could be. So essentially what I wanted to know was, how and why is smoking harmful, and what are the long-term effects, including on treatment? So I knew very little going into this. I basically knew that smoking was bad, but not much more than that. So I want to know what you guys know. So what do you know? It could be about the effects of the lungs, anything about the lungs, why smoking is bad. Anybody have any ideas? Yeah.
It makes the lungs like change color to like a blacker or darker color.
Yeah, and we're actually going to see a video of that in a little bit. Yeah.
Doesn't the tar play a very big job on the inside of your lungs?
Yeah, exactly. So there are a lot of bad chemicals in cigarettes, so tar is definitely one of them, and that's the reason that you're suggested to stay away from them. Anybody else? Yeah.
Does it increase rate for lung cancer?
Yeah, so so we're going to look at that in a little bit. Like she was saying, tar is one of them. There are also some carcinogens in cigarettes that have the potential to cause lung cancer. All right, awesome. You guys knew more than I did. So finding information mainly took place from me looking at research articles and previous studies, looking at informative websites from hospitals or healthcare systems. I also did an interview with a nurse practitioner at my clinic and asked her essentially questions relating to my essential question, and just watching providers treat smokers was how I collected some of this information. All right, so the first part of my question was, why does smoking have negative long-term effects on the lungs? So essentially what happens when you smoke is that there's a lot of inflammation and irritation that damages the airways, and this reduces the amount of oxygen that your lungs can actually receive, which is why there ends up being a lot of trouble breathing, as well as like symptoms like wheezing and coughing. So this most commonly results in COPD, which we talked about at the beginning. 80% of COPD-related deaths are caused by smoking. And these come in 2 forms, emphysema and chronic bronchitis. So emphysema is when your alveoli are damaged. So these are the small air sacs in your lungs that allow the transfer of carbon dioxide and oxygen into and out of your bloodstream. And chronic bronchitis is where your bronchial tubes, which are what allows the air to get carried to your lungs, are inflamed. So there's a picture of the air sac. So as you can see, healthy looks a lot different. Like you were saying, it's a lot darker when they're damaged, and there's more mucus. So when you smoke, the cells producing the mucus in your lungs grow in size and in number, and this ends up clogging your airways because smoking will also reduce the movement of cilia, which you may have heard of from like Honors Bio, which is responsible for movement. And so those essentially are cleaning out your lungs. So what happens when you smoke is your mucus is continuing to grow because cells continue to produce that mucus, but then your cilia is not working, so nothing is cleaning it out, which is why it ends up getting clogged and looking like that, which is not good. And then, like you guys were also saying, many chemicals in cigarette smoke are carcinogens, which is what leads to lung cancer. So this is just a little bit more of an understanding and a visual. So this is looking at chronic bronchitis. This is what a healthy airway looks like. That's what an inflamed airway looks like. And then looking at your air sacs, this is what healthy alveoli looks like. And then with emphysema, it's very inflamed and the cells are essentially damaged. So the next part of the question was, what is the extent of these long-term effects on the lungs? So in short, it really depends. There are some people, like I know one of the nurses at our clinic says her dad has been a smoker all his life and nothing has happened to him, like he's perfectly healthy. But then other people can smoke only for a couple years or not smoke at all and still end up developing a lot of lung-related diseases. So the two biggest factors that we know about obviously are genetic disposition. So if there's a history of smoking and then lung-related diseases in your family, you have a much higher likelihood of getting it, as well as exposure to chemicals or radiation. So like if you work in a factory, which we've had patients come in who've worked in factories but haven't smoked, and that's part of the reason why they've developed these disorders. But we do know that heavy smokers tend to have more severe disorders. And so what defines a heavy smoker is somebody with a smoking history of 30 pack years or more. So a pack year is the number of packs a day you've smoked times the number of years that you've smoked. So if you smoke 1 pack a day for 30 years, that's how you have that history of 30 pack years. Or if you smoke like 2 packs a day for 15 years, that'd be the same thing. So these are the people that lung screening is recommended for and normally have to go see pulmonologists and just will end up eventually going to see a pulmonologist because they can't breathe or they're wheezing or something is happening. So like I was saying, common symptoms, shortness of breath, wheezing, coughing. And then the inflammatory response in the airways does not become less intense after a patient stops smoking, which is a fancy way of saying you can't reverse the damage that happens once you've smoked, but you can prevent the damage from continuing to occur and getting more severe. But in short, smoking does make it more likely to develop COPD and lung cancer. So this is a video that essentially compares healthy lungs to damaged smoking lungs. I don't know why it was on the Rachel Ray show, but it's actually pretty informative. So.
All right. So.
See, now this is healthy? That looks so unhealthy.
I know, but wait till I show you what's healthy though. So this is healthy lung. It's pinkish gray. It's not completely pink like this, but it's pinkish gray, and it's smooth, very smooth. And you can see some of the air sacs in there. Now there is a little black pigmentation. This person probably lives in an urban environment. We all get that from the environment. It's called anthracosis. It deposits some pigmentation inside your lung. But this is a nice looking lung, okay? Now, the great thing about healthy lungs is that healthy lungs will allow you to get that oxygen in. They will allow you to be able to get that carbon dioxide out, and it makes you feel better. So you have the synchronization between your lungs and your heart. They're a 1, 2, 10. Okay, we got that, right? Now, what I also like to talk about is that if you think that your lungs are becoming unhealthy, you need to know your signs of when to go to your doctor. So shortness of breath, okay, upon exertion. So you're doing something, you're getting shortness of breath. If you have dizziness, okay, with changing positions. Also sometimes pain. If you have pain in your airways, it could be a problem. And also this persistent cough. A persistent cough or wheezing. Now, let's talk about what unhealthy lungs look like, okay? I'd like you to look at this. I know you don't want to touch it. But these are bad lungs.
Yeah.
Now you see the
They're
difference?
so distressed.
Now, you can see here, look at all the black pigmentation. This is from the cigarette smoke.
and very little capacity.
Right. There are 7,000 chemicals that are in cigarette smoke. Major ones are nicotine, carbon monoxide, and tar. Okay? And so you can see here they have this deposition of black pigment. Look at here. This is where a dilated air sac, which is called emphysema. So people with emphysema have a problem getting all their air out because the air gets trapped. And this is what it
It's
looks
trapped in the pocket.
That's right, in the pocket
hole.
right here, in this hole right here, okay? This here is your lymph node. The lymph nodes drain your body, drain your organs. You can see all the blackness in here. That's the deposition. And also, look at this area right here. This is like a Brillo pad versus over here, it's
smooth,
nice,
right.
smooth. So you said this didn't look too healthy, but you compare this to this, and you
You
realize
see, it becomes extremely
that's
obvious.
right. But remember, when we talk about lung disease, particularly with smoking, we're talking about strokes, we're talking about lung cancer, and we're talking about heart disease could also be a problem. So you gotta be very careful, and premature aging. If you're doing all these bad behaviors, you're longer going to age premature.
So that was a pretty good visual. You can actually see the damage that is done to a smoker's lungs. And then the last part of my question was looking at how treatment compares in smokers and non-smokers. And surprisingly, I found this was mostly similar. But looking at it, it makes sense that most of the medications are similar because no matter how the damage was done, the effects on the lungs are still the same and you still have to treat it the same way. So bronchodilators, which open up your airways, combination inhalers, which normally have lots of different types of medications. So one of the common ones we use is Trilogy, which is a combination of like the 3 most common medications that are used to treat COPD. And then glucocorticosteroids, which are anti-inflammatory, so they're trying to reduce that inflammatory response that occurs from smoking. The big difference, of course, being that smokers are encouraged to quit as soon as possible because continuing to smoke can reduce the effectiveness. So one of the studies that I was looking at showed that corticosteroids were less effective in smokers, which of course makes sense because if you're continuing to smoke, inflammation is continuing to happen in your lungs, so using an anti-inflammatory isn't going to stop that. And so smoking history doesn't impede treatment per se, but it can affect how severe the disease is. So you don't want to keep smoking even if you know you have a disease because it's just going to get worse. All right, so we have a Kahoot. All right, great job. That's really good. Leave candy for the top 3. Thank you. All right, thank you guys so much for listening. I hope you had fun with the Kahoot. Do you have any questions? Yeah.
Is the tar like the same that they use on the roads? Or is it like
I don't know. That's a good question. Is it the same? I guess it is. Yeah, exactly. So, in short, you shouldn't smoke. It's not good for you or your lungs. Anybody else? All right, well, if you're interested in learning any more about this, pretty much everything we do throughout the year is on our Wix page. So mine is edewan.wixsite.com/HMP Pulmonology. But yeah, thank you so much for listening.